All right, here we are back at the second session. I've had my little rest of about 3 or 4 minutes, and I checked my health impact software application on my phone. So it's the team from the Norwegian University of Science and Technology with Professor Ulrik Wisloff, who created the research and science. He's been putting the algorithm together for, I think now 20 plus years, and he's created a piece of software which allows you to convert your heart rate pattern into a point score called activity quotient points, AQ points. And you can join the Perfect Health Lesson community and get a free version of that software that tells you how many activity quotient points you're earning. And I started the day based on my previous 6 days of physical activity at 90 points, and my minimum target for me is to get to 100, because the research from Professor Wisloff and his team up there in Norway through the Faculty of Medicine and specifically the Cardiac Exercise Research Group shows that earning 100 activity quotient points and staying there on a rotating 7 days reduces your risk of chronic disease at the highest level. So for example, just off the top of my head, 30% reduction in complications from being overweight. That is unbelievable. I don't know any drug, medication or pill that can have a 30% reduction in complications. Imagine if you combine any medication for excess weight with using activity quotient points. There is a 54% reduction in complications from type 2 diabetes by hitting 100 activity quotient points. What else can I think off the top of my head? A 26% reduction in risk of dementia. For me at 59 years of age, I don't know about you and the age you're at, that is a huge risk as I get older, and so I like to see that reduction. There is I think it's a 38%, it's on my website, theperfecthealthlesson.com, this list, but I'm going off the top of my head, a 38% reduction in risk of a catastrophic cardiovascular event, like a heart attack or stroke, #1 killer in men and in women. There is, what else have we got on that list of reduction? Oh, fatty liver disease, be it 17 times less risk of fatty liver disease. And there's a whole host of other reductions in clinical complications from what I call the big four: excess weight, catastrophic cardiovascular events, high blood sugar, and metabolic syndrome. A 30% reduction in blood pressure, for example. That's another one, by hitting 100 activity quotient points. When you first start, you'll learn that if you're not used to physical activity, you don't need to hit, just checking my heart rate. By the way, that first 10-minute session that I just did, I averaged 79% of my maximum heart rate the whole time, which was my target was 80, so I'm 1 off. So I'm trying to go slightly higher. So I'm out of breath here again. And so that's what activity quotient points do. I was on 90, and then I checked the health impact software, which I want to give you for free, link in the show notes, and I'm now on 94. So if I go slightly higher, I should better report back to you for the third and final session. Before I start the third session, I should be on about 99, about 5 activity quotient points I'll earn in this 10-minute block. So here we are, what is it now? I'm 4 minutes in, almost into this particular activity block. So here's what I said I'd talk about in that introduction segment where you saw me live cycling here in my lounge room. So, and I'm doing it because AI is not reproducing this. This is real stuff. So here we go. Oxygen efficiency. Let's talk about that first, and then hazard ratios. Oxygen efficiency is my body's ability to transport, so I'm breathing in air right now, and then as that air comes in, it's got about 22% oxygen molecules in the air. I have inside my lungs these tiny air sacs with blood vessels around it called alveoli. These air sacs, there's about 500 million of them in your lungs. So in my left lung and my right lung and yours, there's about 250 million in each one. Their job is to extract oxygen molecules and then attach it to red blood cells. Wrapped around those red blood cells is a protein molecule you might have heard of called hemoglobin. Now, once the oxygen molecules disassociate themselves from the air I breathe in and attach themselves to the red blood cells in my alveoli, my air sacs in my lungs, it then gets transported to my heart. My heart picks up that oxygenated blood, and then my heart pumps. Right now, as we talk, it's pumping at 137 beats a minute. That's good. I'm very comfortable. Sounds like I'm puffing, but I'm very comfortable. I don't feel any, apart from puffing, I don't feel any muscle soreness or lack of oxygen. And so what happens is my heart's pumping 137 times every minute right now as I look at my watch, and it's pumping oxygenated blood through my arteries, down to my capillaries. At my capillaries, the oxygenated blood gets dumped off into my muscle cells and into all my cells in my body. Because as human beings, we all know this, without oxygen, you can't survive. So what happens is we can score how efficient my body is based on my age and my gender. 59 years old, male, different for you based on your age and gender. We can score where you rank with your VO2 max score, which I love using the term oxygen efficiency score. Can't help understand it properly. So right now, today when I woke up, the Health Impact software report, now this is the premium version of it, it tracks AQ points, activity quotient points for free, and it converts those points into a VO2 max score, a validated VO2 max score by the Faculty of Medicine at the Norwegian University of Science and Technology and the work of Professor Ulrich Wislar. Unbelievable scientist, great guy. Interviewed him several times on the show. Anyway, so my score on that software this morning was 50 milliliters per kilogram per minute, which means I had a score of 50 for my VO2 max. Now, at 59 years of age, when I look at the standardized tables that doctors' medicines produced around the world, that places me in the top 2.5% for my age and gender. And I have a target between the ages of 59 and 60 to get it to this extraordinary level of 60 milliliters per kilogram per minute. Very few people in the world who are 60 years of age have a VO2 max that high. So, an oxygen efficiency score. So you can find out what yours is by using our software. Now, what I want to talk about, how many minutes am I in now? 8 minutes. I want to talk about this topic called hazard ratios. Because the higher that score, the lower your risk of chronic disease, lower
Welcome
your risk
to this
of
Oran
premature
Park
death,
High School video
lower your
learning
risk of
episode.
sickness.
This is your
The
first unit
benefits
in PDHPE.
Proven
Changes.
by science.
Starting high
in real
school is a
life
big step,
for longevity
and with it comes
and
a lot of
health span.
changes,
When you
physically,
learn about this
emotionally,
topic
and
called
socially.
hazard
This unit
ratios,
will help you understand
it
these
is
changes
phenomenal
and how to manage them
because
with confidence.
the thing about
We'll
hazard
explore who
ratios
you are in sense of
is
self
that
and
you
identity
cannot,
and how to navigate
there is
change and
nothing
transition
else
into high school.
yet discovered
We'll also
that you
break
can
down
do,
physical changes
whether
during
it's
puberty,
medicine,
covering
whether it's
everything
surgery,
from growth spurts to body
or
image.
any other intervention.
But change isn't just
There's
physical.
no other intervention
You'll also learn about
other than
changing
raising
relationships,
your
with
oxygen
friends,
efficiency
family, and
score,
even
your VO2
yourself,
max,
as well as the
There's
new
no other
responsibilities
intervention
that come with growing up.
more powerful to
This
improve your
unit is all about
longevity and
helping
health
you
span.
feel prepared,
And at my age,
informed, and
I have a
supported
15-year-old
as
son
you go through this
and my
exciting
wife,
time in your life.
and I want to stick around.
So
I don't want
let's
to be gone
dive
at
in
70.
and explore the
One of
amazing
my
journey
sports
of
heroes
change.
died yesterday. George Foreman, boxing world champion at 76. I don't want to be gone at 76. I want to be here for my family, predominantly. And so, I'm pushing my VO2 max score as high as I possibly can. Thought I'd show you that in real time. Here we are. So, I'm going to finish this session. We now got 30 seconds to go. Heart rate's all the way up to 139, which is great. That's where I want it to be. That's going to be about getting close to 85%, maybe not quite, of my maximum heart rate. I'll talk about maximum heart rates in another segment, not today. The last segment I'm going to talk to you about in my final 10-minute cycle is going to be about hazard ratios. You're going to learn about that in real time while I'm improving my oxygen efficiency score. It's not that hard. Like, I'm puffing, but I'm watching a bit of sport in the background, doing a bit of teaching now for the first time while I'm doing it. I find it fun. So we'll do more of this. And I'll show you different physical activity sessions that I'm doing that will help showcase how I actually improve my oxygen efficiency score and what technology I use to track it. All right, back in a second. Final 10-minute segment about hazard ratios that prove why raising your oxygen efficiency score, I'm done my 10 minutes, why that is the number one thing you can use to increase your longevity and health span. All right, back shortly.